Hey guys, my name's Sam and welcome to Prep Medic. In this week's video, we are taking an in-depth look at my SWAT Medic bag. Alright, so this bag is the bag that I'm taking with me as a tactical paramedic. Now, we operate a little bit differently in Colorado than we did in Iowa. I am not a member of the entry team. I'm not actually a member of SWAT. We are a member of the Special Operations Response Team, which is basically a team that attaches to several different SWAT teams. We also do some high-angle rescue as well as search and rescue, and then we stand by for things like dive rescue as well. So this bag here is what I have most of the time. You guys saw the bag that I have for the All Hazards Response Team, which is much more wilderness medicine oriented. This one's a little bit more streamlined, and I'll kind of explain some of the concepts here as we go along. Now, the other thing I need to mention about this is that a lot of the things in here supplement what I have on my vest or persons. So there are some things I don't have, some things that aren't quite as easily accessible as they are on my vest, but that's because this is kind of my second line of medical equipment, not my primary. I try my best not to get into this bag if at all possible and use what's on my body first. So the bag itself, this is the NAR4 aid bag by North American Rescue. I've had this for a while, and luckily they kind of let us build our own kits on this team, so I got to reuse this bag, which is always a good thing. Super solid bag. I've had this now for I think 2-3 years, and it has worked very, very well for me. The outside here, it's got the loop swath here, and I just have the paramedic identifier, the sort identifier, and then my TAC Med paramedic patch, which came from TAC Med Essentials, which was one of the first tactical medical schools I went to. On the front here, I have the Winkler knives fire rescue tool. This thing is awesome. So you've got a window break. This can also be used for like a pick for, getting out of the ice. You can turn off gas valves and stuff with this, which is actually pretty important in the SWAT realm. And then it can fit a couple different sizes of hexes. It can also be used as an extrication tool here to kind of pry things open, pry a small door or something like that. Not a breaching tool by any means, but it is super handy. So I just keep that right in the loop in front of this pack. And then on the side, I have one easily accessible tourniquet. So this is in the Blue Force Gear Tourniquet Now is what's securing it, which is a super cool little device. And really, I just want one tourniquet on the outside of this pack that somebody else can grab. If this is on my back, somebody can grab it and go treat somebody. On the outside of the pack, I have redundancies on the inside because anything on the outside here is liable to get lost. So if this one goes missing, it's not a huge deal. If I rub against something and it comes out, not a big deal. I've got more in the pack, and then I carry, I think, 4 on my gear itself. I just like to have something that's super easily accessible on the outside. The back of the pack, I've got these 2 straps. Now, I'll be honest, this is one thing I don't like about this pack. These are way too thick for a tactical pack. It does not fit over the armor very well. I can loosen these up way, way loose, and it fits relatively comfortable, but it's a lot better if I don't have armor on. So that's the one thing I don't like. This does have the option of clipping it directly to your armor, but a lot of times I don't actually carry this with me. I'll just leave this at the front door as we go in, or it'll stay in the Bearcat depending what the mission is and how far away it is. So like I said, a lot of my primary medical supplies are on my persons as we're doing a mission. So getting into the pack, I really like how this is laid out, and for those of you that have seen my previous SWAT Medic gear layouts, I've kind of changed this one up to conform a little bit better to the March algorithm. So coming up here to the top, we'll take this out for now, I've got 2 bleeding pouches, and I have one labeled tourniquet here because I want to make sure that people know that's where the tourniquets are. So in this pouch, I'm actually carrying 2 Gen 7 cat tourniquets. And those are in there. They're a little bit deeper. People say, well, you shouldn't keep them in the middle of your pack because they're harder to get to. Like I said, I've got a lot of them on my body, and then I have the other one easily accessible on the outside. This is when stuff's really hitting the fan, and I've got to either reapply another tourniquet to somebody that's still bleeding, or it's a mass casualty scenario, so we're starting to hand these out like candy. So those fit right in here. I think one thing I'd change about this pack is I really like Mystery Ranches, the way they have the clear bag so you can see everything. Having these not clear. It's a little bit harder to know what's in there. We do have these labels, which is super nice, however. So in this one over here, I have everything for wound packing. So in here, I've got 2 things of combat gauze. These are the same things, they're just packaged differently. One's supposed to be Mill, one's Leo, it doesn't really matter. And then I have 2 things of NAR compressed gauze. I've kind of changed my tune on the hemostatics. There is some good recent studies on these and their effectiveness. These are definitely the gold standard. But what's really helping the people is the pressure. The hemostatic agent in here is helping, but if you don't have good pressure, it's not going to do what you need it to do. So these are kind of my backups that if I'm packing more than 1 wound, I'll use these first, however. All right, coming one down, we've got the Airway pouch. So this pouch here, right above it, I've got an eye gel. So this is a supraglottic airway. This is just easily inserted. You just lube up the back of that and you just insert it. It's easier than an OPA. Our department actually goes to these primary for cardiac arrests. They don't even do bag valve mass respirations at any point. They just put one of these in and go for it. So if you do have advanced airways and ET tubes, I always advise having some kind of backup. So this is what I have kind of as a backup airway or something really quick I can insert. So I have that right here. These are not very compact, so I only carry one size, and it's the size that'll fit most of our team members. So this is the 50 to 90 kilograms of ideal body weight. So it's kind of the universal adult size, although there is a chance I'll encounter somebody that's too big or too small for it. In the airway compartment, so this is a bifurcated compartment. You've got a flap on the top, and in the top here, I've got a bunch of ET tubes. I've got all the main sizes, and then I have the 6.0 tube marked off because that's what I'll probably use for a surgical crike. One thing I forgot to mention is when you first open it, I have this 28 French NPA just staged right on top because this is kind of your first primary airway you're inserting in a tactical situation. So the 28 French, once again, is kind of the universal adult size, but there is a chance it's too big, too small for somebody. And like I said, I've got the ET tubes up top. I've got all the main sizes there just in case. Yes, I know we're not intubating people in a tactical scenario. This is for when we have them in the Bearcat. I have my cardiac monitor, my other meds with me. We can do direct intubation. I also carry McGill forceps for clearing an obstruction. And then below that, I have a tube securer. So this is just fancy tape. It goes around the ET tube, holds it in, can be used on the eye gel as well. Really important if you're doing a lot of patient movement. Below that, I have a laryngoscope with your common sizes of blades, both Mac and Miller, for your intubation. And then right under there, I have a scalpel and a bougie. So these combined with your 6.0 tube usually go down a size to do it, will give me what I need to do a surgical cricothyrotomy. Now, I do carry both of these items on my vest itself, but this is kind of a secondary option for me. And then this bougie is basically an inducer. So you put this in and then, introducer. You put this in and then you put the tube over it and it helps you guide it into the trachea. So really good tool to have. I don't carry a trach hook. I haven't been trained really to use a trach hook. So this is kind of how I've always been trained to do a surgical cricothyrotomy. And then the scalpel here is a safety scalpel. One more down, I carry the pocket BVM. So you guys have seen this a ton. I've got a bunch of these, and this is just a very small collapsible bag valve mask. Connects to ET tubes for your surgical crikes, your intubations, your eye gel there, and it allows you to breathe for the patient without doing mouth to mask, anything like that. So that all sits right in this airway compartment, and it sits pretty well. So we've got the march, the massive hemorrhage, and then we're getting into the airway. To supplement these, I do have a bunch of chest seals over here that kind of goes along with your airway breathing. These are kind of the hodgepodge. I carry all the hyphen-vented chest seals on my person, and these are kind of what I had left. So I've got a halo chest seal, which in my opinion isn't that great, and then the hyphen-vented chest seal in there. So entrance and exit wound. And then down here, to go along with your airway as well, I carry 2 ARS needles. I'm not carrying the spears yet. I don't have approval to use those. But these are 14 gauge decompression needles that you can use for a tension pneumothorax. I do want to get some 10 gauge. They do make these in 10 gauge, which I'd say is kind of your better option. But this is what's supplied for me, so that's what I use. So we've got the massive hemorrhage, the airway. Now we come down into circulation. So this pocket, I'll be completely honest, is kind of a hodgepodge, and I'm still trying to arrange it so that it works a little bit better for me. But in here, in the main pocket, it's bungeed down to hold everything still. I have a 100 ml bag of sodium chloride. So this is great for your really small infusions. I personally like this bag for ketamine for pain control. You can put your dose of ketamine in here and start running it in really slowly. Gives you a little bit of a better effect for the patient in my experience. Behind that, I've got a 250 ml bag of D10. We're basically using this for our diabetic wake-ups. We're not using D50 anymore. This is just a little less caustic, wakes them up a little bit better. And keep in mind, a lot of this isn't care under fire. This isn't what we're doing here. This is when we have the patient loaded up, or say you have a very combative patient, it's potential that SWAT gets called out for somebody that's really combative, and it might be a blood sugar issue. So I like to carry everything for blood sugar emergencies in here. And then I have a 500 ml bag of normal saline. No, we're not carrying lactated ringers for the balanced solution. We're using this now for fluid resuscitation. But once again, we're not really giving a ton of fluid in trauma situations because really what they need is blood, and this is just gonna give them some hemodilution, which isn't the best for them. The blood pressure can kind of wait to get brought up until later. I also carry two 10 ml saline flushes for your IV starts and drug pushes. And then behind that, I've got a 15 drop set for your infusions to connect to those bags. Only carry one. I'm probably not gonna hang in multiple while we're in that situation. We have another bag with a lot more fluids and IV stuff as well. In this pocket, I've got North American Rescue's saline lock kit. So this has two 18 gauge needles in it, a securing band, a swab, pretty much everything you need to start an IV, and I've really enjoyed these. They're super easy to use and pretty cheap actually. I think this is like $7 you can buy one of these on their website. In this pocket, I just have some administration things, so some 3 mLs, some 1 mLs for your epi. Next to that, I have the main drugs I carry in this pack. Now, this stuff is not your controlled substances, otherwise I wouldn't have that at home with me here. We have another kit we get when we come in that has all our narcotics, so our fentanyl, our morphine, ketamine, etomidate, all our paralytics for RSI, all of that stuff. Oh, and our benzodiazepines for sedation and seizure control. That will supplement this. But in this kit, these are all the non-controlled meds that I think are important. So in here, we've got your nitroglycerin spray, which is for your cardiac chest pain. That goes along with your aspirin tabs. Really simple, but it can actually make a difference in your cardiac patients. I've got glucagon here for your diabetic emergencies. Solumedrol, and this goes along with everything in here I have to treat anaphylactic reactions. So if we're at training, somebody gets stung by a bee, or even on a mission, or somebody gets pepper sprayed in the face and they have an allergic reaction, I want to be able to treat that quickly. I've got 2 vials of epinephrine 1 to 1,000 for your anaphylactic reactions. That could, in theory, be reconstituted to a 1 to 10,000 dilution for your cardiac epi. If I was in dire straits, we had a cardiac arrest, and that's all I had, I could do that. And then we're carrying diphenhydramine, which is also for your anaphylaxis, minor allergic reactions. And it can also be used to treat dystonic reactions. If somebody's been administered a lot of Haldol or they're on a lot of psychiatric medications, sometimes they'll get this muscle kind of tensing. It's called a dystonic reaction, and diphenhydramine is the cure for that. So with some of the people we deal with, that's something good to have for their protection. Carry mag sulfate, which is a very versatile medication. I have it in here for its anaphylaxis. So for somebody with severe bronchoconstriction, I can start a mag drip on them, and that will help with the bronchoconstriction there. And then I'm carrying metoclopramide here. That's for your nausea, vomiting, and then Zofran, which is also for nausea and vomiting. And I have the Zofran in the IV form and the tablet form to put under their tongue. That's not really an emergency. Like, that could be, you know, coming down out of the mountains in the ambulance. You know, I've had students puke on me. I've gotten sick in the back. So if you really need this to do patient care, you can do a self-administration there. Or, you know, your patient you really don't want to get puked on. So give that really good thing to have. On the back here, I've got a lot of administration things. I have 2 things of Narcan. So I'm not carrying a crap ton of Narcan. If you're curious about potential fentanyl exposures and stuff, I have a video on that you can go check out at your convenience. I'll leave a tag up here for you to check that out. So I have 2 vials of Narcan, and that I believe is 4 milligrams total in this case, which is plenty to deal with most situations. And then I have a MAD device, which is an atomizer. You can give that intranasal if you don't have IV access or don't want to give it IM. It's pretty good absorption so long as they don't have a head cold. Only other drug here, I've got glucose paste. Tastes really nasty, but you know, for somebody that's conscious having a diabetic issue, you can give that to them and they can just suck on that for a while, bring it up without doing any invasive procedures. On this other side, I've got some more administration stuff, just some IM needles here for your quick IM administrations or drop, depending. I've got a pen light for pupil assessment on this side, and that's right with the ARS needles there. And then in this compartment, I've got my vital things. So I'm missing 2 things I usually have in here, and that's because I'm using them for something else at the moment. But I've got a blood pressure cuff and a stethoscope. This isn't my usual stethoscope. This is an issued one. So it's a very pretty color of blue, really goes with the tactical environment. And then usually in here I have a small little finger pulse oximeter. I actually ordered a second one from Amazon. Same one I carry in my Wilderness Medical Kit because I really liked that brand. And then a glucometer is usually in here, but I actually got that co-opted from me for a truck. So waiting to get that back, get another one in here. That's what goes in the vital thing, just a really quick ability to assess somebody. And you know, this is done kind of after the fact. In here as well, I carry another MAD device for your intranasal administrations. All right, coming over to the lid of the pack. Down here, this goes along with your bleeding. I've got some trauma wraps. These are kind of miscellaneous emergency trauma dressings from North American Rescue I had sitting around. They have so many different packagings of these things. These are all the flat wraps because I noticed this pack was getting kind of bulky. It was a little bit hard to carry around. So I've switched them all out for these guys here. One up from that in this middle pocket, I carry everything for your splints and minor bandaging. So in here I've got 2 triangular bandages, super useful to have. I would recommend everybody get a bunch of these. They're also called cravats, used for slings, swaths. They can be used for bandanas, bleeding control, pressure bandages, tying on a splint, you name it. I've got a roll of just a wrap there for splinting. And then behind all of that, I carry a SAM splint. So really versatile splint you can use for arms, legs, use it as a makeshift C-collar, any number of things. So really interesting thing to have. Not really done in a combat scenario, so I don't really need the green one. It just costs more to get the green one, so I just go with what I have as the orange. I do carry a small survival blanket. This is just to help keep people warm. Hypothermia kills and trauma. And then I've got 2 hot packs here. So this is mainly for teammates that get cold, but it could also be used to pack in that warming blanket under somebody's clothes to try to get them a little bit warmer, give them some extra heat. And like I said, in the top here, we've got the 2 chest seals. The one last thing I carry on this, and in here I used to have a mega mover that's now on the back of my vest that I always have on me, so I stopped carrying it in here because it was kind of bulky. But in here I have a SOAR Rescue Med Mag, and this is their Triage Med Mag. I'm gonna have a full video on their entire lineup of these. These things are freaking awesome. But this one I carry in here because if we are in a mass casualty scenario and we've switched gears from that tactical realm, I'm not with the team anymore, and we're actually just doing a mass casualty triage of patients, I've got this I can open really quickly. This in here, it's got a couple red, green, yellow, white mini glow sticks in there to mark somebody in a dark environment. This also has your start triage cards and deceased cards, God forbid. And then it also has a reference card and a patient tracker in it, and then a Sharpie. So this is everything you need to initiate triage. What I like about this is it's all in one neat little case. I can throw it up in here, and I don't really have to worry about the individual components getting messed up or bent or anything. It's just in a nice package right on the side of this pack and really easy to stow there. So that's what I carry in this pack. I'll be doing videos of everything else I carry on me, on my vest, on my belt, everything like that. I'll be releasing these videos one by one because I need content. And like I said, I'll be doing a video on the rest of these med mags because they're really cool products. So if you have any questions about anything I showed you today, please leave them in the comments down below, and I will see you next week.